So it turns out coronavirus spread throughout American cities undetected much, much earlier than anyone realized at the time. That's according to a new report from the New York Times. On March 1st, 5 major U.S. cities, New York, San Francisco, Boston, Chicago, and Seattle, had a total of 23 confirmed cases of coronavirus. But a model of infection rates by researchers at Northeastern University estimates that there could have actually been 28,000 undetected infections in those cities by that time. This visualization from the Times shows a remarkable disparity between those two sets of numbers. The model suggests that by the time New York had its first confirmed case of coronavirus, there were already 10,000 people infected. This new information as New York begins work on a plan for widespread testing and contact tracing. Joining us now, New York Governor Andrew Cuomo. Governor, we meet on a day of some pretty momentous political headlines and pretty momentous science headlines. I want to start with the science. You shared some information in your briefing today about antibodies. Is that encouraging? And can you take us through how many New Yorkers, based on this early study, may have already been exposed to COVID?
Yeah, no, it was surprising. We did a 3,000 person survey, which is fairly extensive, all throughout the state. Statewide, it was about 14% of the people had the antibodies, which means 14% of the people had the virus. That's about 2.7 million people in our state. New York City was close to 20%, wow, which was surprising. Yeah. So the good news is these are people who have the antibodies. They can then donate blood for the convalescent plasma, which is probably one of the best therapeutics that show promise. The other good news is, we talk about the death rate. We have about 15,000 people who have died in New York. That's hospitalizations in nursing homes. That doesn't count the at-home deaths, which we still have to calculate. But it's 15,000 on a much larger denominator. So the death rate is like 0.5. The normal flu is 0.1 to 0.3. So it gives a perspective on the death rate if you're looking for a silver lining.
I think we're all looking for silver linings, and I think it makes clear how much of the science is unfolding as we navigate the crisis. Another piece of reporting on that front is a New York Times report that suggests that there were as many as 10,000 infections in New York at the beginning of March. What do you make of some of the news reporting and some of the studies that show that it was here much earlier than we thought?
Well, look, it's an eye-opener. I think it's important because we have to do a retrospective on this, because I'm afraid it's not only in the past, it's going to be in the future. They've been talking about a possibility of a global pandemic for many, many years, but it never really happened. And until it happens, it doesn't really get people's attention and it's not actualized. But now, look, we're learning. When they say that China has a virus last November, last December, then I think the flares have to go up at that point, because if China has a virus, that virus is going to get on a plane. It's going to go to Europe. Right. It's going to get on another plane. It's going to come to New York. It's going to come to California. So they're now saying that the virus was here in February, maybe January. Right. So all these actions we're taking in March, the horse is out of the barn.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.